Well, according to the World Health Organization, there have now been at least 887 deaths from Ebola and more than 1,600 cases since the outbreak began. Most are in Guinea, where the outbreak has killed 358 people. The virus has claimed 255 lives in Liberia. In Sierra Leone, the death toll is at 273. Meanwhile, a second American aid worker infected with the virus has passed through Maine on her way to a hospital in Atlanta. But state health officials say it's worth repeating there is little to no risk of the virus here in the state. Bangor International Airport was on high alert this morning as a plane originating from Africa touched down to fuel up and go through customs. On board, an American aid worker suffering from the deadly virus Ebola.
It's also known as Ebola hemorrhagic fever. So the patients do present with a fever, they get a rash, they can get a lot of electrolyte imbalances, diarrhea, dehydration, and they can bleed into their conjunctiva, and they can have blood in their urine.
Dr. Sheila Panett is the head of the Maine CDC. She says while Ebola is a serious health risk, there is no risk to people here in Maine. That's because even though the plane stopped here to refuel, the patient and healthcare providers stayed on board inside of a containment area.
The cabin of the aircraft actually is a hospital medical ICU-like, and it was self-contained, and so the crew was actually separated from the actual victim and the medical team, which was using hazmat suits and all the precautions of bloodborne pathogens, so making sure they had masks on and gloves and protection for their whole body.
But while Dr. Panett says Mainers shouldn't worry about Ebola here in the state, she does say people should be aware of the signs and symptoms and take precautions, like avoiding travel to areas like West Africa.
Certainly it's a personal decision, as with anything, but I would definitely advise people not to travel right now during an epidemic, because the most important thing is to isolate people from the victims, and I don't think people should want to put themselves in harm's way.
And while travel to West Africa is discouraged now for the general public, Dr. Panett says the federal CDC is sending investigators there to help contain the virus.